Hello everyone, hope you all are well. It's my pleasure to share with you this topic which is very close to my heart. I'm sharing with you this topic entitled Development and Evaluation of Virtual Counseling Application for Communication Skills Training in Nursing Education. I have a lot of things to share. It's a mixed method study and I have only 20 minutes. So without further ado, let's begin. Starting with the background of this topic, communication is an essential skill which is important for successful patients' outcome. Studies have shown that it influences physical and emotional well-being of the patients. We have done both local studies and this immense literature which shows that nursing students often feel stressed out if they do not have enough practice hours in learning communication skills, and literature has also shown that shortage of specialized communication skills training often stressed out nursing students, and if students are not confident in communicating well with their patients, it influences their clinical postings. So just a bit of a background, at ISC Center for Nursing Studies, communication skills training has been given to students as a core module to year one undergraduate nursing students since the past decade. It's a core module, 3-credit module, and it has been taught didactically over the years. So about 4 or 5 years back, I have taken this module as a module lead, and I offered to redesign this module by using blended pedagogy. I got NUS Lift grant, and as you can see from the pictures on the side, I have published papers in Nurse Education Today where we have shown that we have introduced interactive sessions like role plays, standardized patients for students to have more opportunities to practice these communication skills. Our year-end module feedback as well as the data we collected from the students, it shows that students appreciated the efforts of giving them more interactions to learn communication skills rather than just teaching them very heavy on communication skills. However, the long-term benefits of what we have taught the students in the year one was not something we could evaluate. And also students felt from the graduate exit surveys what we received from our graduating students that they feel that year 2, year 3 students, they should have some continuous training beyond year one about their communication skills, like a reinforcement. So that's where the idea for this module took place, or rather this study took place, and I propose to develop and evaluate the effectiveness of VPs, which is virtual patients-based clinical scenarios in providing communication skills training to nursing undergraduates on various learning outcomes. The primary outcome was self-efficacy. In a very layman term, though it is not the case, but it's an objective like self-confidence a person feel about the ability to perform a particular task, in this case communication skills, and their attitude towards learning communication skills. And we were specifically interested in finding out how confident these students are in communicating with actual patients at the year of and clinical postings when they go out at the end of the semester postings. So we use a mixed method study design, and it was a 2-phased study. As it was not possible to randomize the students ethically to give them something like virtual patients for a group of students and for others not, so we use a quasi pre-test, post-test longitudinal experimental design. First we develop and then we evaluate these virtual reality-based scenarios. And on top of getting surveys, we also specifically believe that hearing via in-depth interviews, hearing students' views about what were the strengths and weaknesses of these specific virtual scenarios was very important so that we can continue to improve them. And the highlight of this study was that not only students, we also interviewed clinical facilitators or instructors who facilitate students' clinical journey at the end of their clinical posting during the end of the semester clinical postings. So like any good study, especially when you're doing an intervention study or developing any intervention, I do a fair bit of clinical studies. I believe that we should have a theory behind developing those scenarios. So specifically for this particular virtual patients, we use authentic learning environment proposed by Harrington and her colleagues, as well as Bandura's self-efficacy theory. So a little bit on this development. I just took a snippet of, if you can see from these GIF images moving on the side, that it's a long road ahead. It took us more than 6 months just to develop 4 scenarios. Like, why 4 scenario? Because of logistics and all that, and because of the budget involved. It takes a lot of time, efforts, and of course we needed a lot of, though the project was funded by Ministry of Education, but we still needed to have some top-ups. That's why I'm very thankful to NUSIT. And of course we had to take note of a timeline. So this paper is already published in JMIR. If you would like to read, I'm very happy to answer your questions. You will be seeing me live soon in 10 minutes time, another probably 15 minutes time. And yeah, I'll be very happy to share with you my papers. And if you can see this maps we have prepared just for one scenario, how much you have to come out of it. Because the thing is in order to speak to a virtual patient, you have to actually train a machine. There can be many permutations of what a person would say to a virtual patient, to come up with a communication scenario. So it was a tedious road ahead. So this is what I would like to share with you. So basically, I'm very thankful to this and the next slide, which is shared with my NUS IT colleagues. The programs used to develop these 3D artificial intelligent chatbots. And I'll be sharing with you a live video, a demo of this the VPs we have developed, and they were able to simulate like gestures. So they were able to show pain, gesture, and students can have reiterative access, and they could do simple assessment on these. Another slide to just show you, I'm sure some of you definitely probably very excited looking at that slide. They will send a speech to a text API, and then Unity 3D. This is apparently it's our so-called the text stuff which we have already in NUS. We make use of that, and I will go back to NUS. And then we had this data administrator who was working offline and with all those stuff. We were having difficulty because the so-called the language, I would say platforms or recognition tools which are available in the market now, they're very much westernized. So we speak Singlish, our students speak Singlish. So when students were trying to speak to the bot, or rather I would say virtual patient, the machine was not able to recognize our student's voice. So that was some of the challenges we had. Like I said, in my simplified way, I'm just putting in some pictures. I'll be showing, I'm actually spoiling it. I'll be sharing with you in my next 2 slides how actually the bots look like. And yeah, we just wanted students to handle the communication skills in different scenarios and engage them one-to-one. And we wanted to have uniquely expressive, realistic, non-verbal cues, facial expressions like angry face, fold arms, and shift eyes and all that. So we wanted to have all that experience for the students. So in my next slide, I'll be sharing with you how actually my scenarios look like and how actually students entered into their virtual world. So it started something like that. So this would be our first so-called the opening slide when the students go into the virtual machine, and then they will have scenarios, different scenarios to choose from. And then after that, students will go through this small training. So this was very important. Again, this one we came across after 1 or 2 UATs that we need to have that voice training, speech training, especially in our local context. So we give them like few different words so that the machine can recognize how certain students speak. So they have to get like certain 10 or 15 words right before they can actually start speaking to the machine. And yep, that's just a picture of a snapshot of a pregnant scenario. And then this is a depressed patient. Sorry, I'm going a bit fast. I also have a video just to share with you. So, and also if you want to get a copy of my slides, I'm very happy to share with you. And yes, so this was another scenario where we have this Sbar when you escalate an issue to your colleague or speak to your colleague. So yeah, so we give like this a background about a patient so that students have a history of a patient when they are talking to a colleague. And yeah, so that's how feedback looks like the students will get at the end of the thing. And this was something very close to me, this scenario, which we added like especially for the students in year 3 or when they're passing out. This is their year-end posting. They call it T2P, transition to practice posting. So they often get very stressed. So this student was very stressed, and then we just didn't want it all just clinical scenarios. We wanted, like I said, authentic scenarios, how they can manage conflict at work and how they can help a colleague who is stressed out. So that's what we taught. And then a quick one. I know time is of essence again. So like I said, it's a mixed method study. I'll just quickly share with you. Of course, I would not be able to give you details and of course discuss these findings, but I'm very happy to answer your questions, so I can share with you my papers. For this quantitative finding, this paper is in my first revision. So hopefully by the time when I'm presenting, it will be published. So yeah, we started with, we total for the year 2, the cohort, AY 17-18, we started with that group of students. We had total 149 students, so 104, they agreed to participate, but of course we had some attrition along the way. And we measured self-efficacy and attitude skills as well as the communication skill performance at the end of the clinical posting. Just to let you know, this is again a quantitative score. We have developed a checklist just for your information, and we use online system in Alice Lee to measure the clinical communication skills scores, which is actually measured by the clinical facilitators or clinical instructors when students go at the end of the semester clinical posting. Yeah, and we use data analysis via these statistical methods. And So this is just a distribution how it looks like. So year 2, semester 1, then year 2, semester 2, year 3, semester 1, and year 3, semester 2. So these were the clinical postings, the pre and post test. So they had a VP training, and then we had a post test questionnaires, and then we had a clinical posting. Of course, I just to let you know upfront, we had a lot of hiccups, and those who are new to research world, I'm going to upfront share with you that no study is perfect, and this study was also not something which was escaped from that. We had a lot of limitations, and one of the things was that like clinical skills scores, we were comparing it with the historical clinical scores, right, from the previous batch. But the thing is this, we had a curriculum change. So with that, the comparison with the previous batch was almost impossible, because the clinical postings which students were going now and the previous years were all different. So it was a nightmare comparing them. So we had a lot of difficulty. Yeah, because of time, I can't really give you details like in one slide like that. I've written all that in paper, but yes, just to tell you, as far as you know, there were issues and you put right up there. So it's important to acknowledge all that in your study. So yep, quantitative findings. So just to let you know, these are our communication skills, attitude, and the efficacy skills, and the pre-test to start with. And these are our post-tests. So the study, as far as the attitude skills were concerned, just for the first 2 scenarios, which was the pregnant and depressed patient, there was a statistical significance differences, but not for the other 2. That means in a year 2, they showed statistical significance and not in the year 3. And similarly for the self-efficacy scores, generally they maintained their efficacy scores, as you can see, but statistical significance p-value was shown only for the pregnant scenario and the last one, which was the stressed colleague scenario. So yeah, that was for the quantitative findings. And then for the comparison scores, like with the clinical postings, for the postings with the pediatric and obstetric, as well as for the males who go for the, now the name has changed, the CDC, which means communicable disease, the students actually had lower scores. Those who went for virtual patient, they had actually lower scores compared to the historicals. And then when come to qualitative findings, we had in-depth face-to-face interviews with the 24. Like by 24, it was by data saturation, and also just to let you know, all the students were invited to participate in the qualitative interviews. Only few agreed, and then data saturation happened. So we had only 24 students agreed, and then 6 clinical facilitators, all audio taped and transcribed. So we had 2 overarching themes came for the students and the clinical facilitators from their interviews. And there was an overlapping theme of value of technology in teaching communication skills. So of course, this is itself a 1-hour presentation, so I won't go into details. So these are some of the sub-themes. Again, this paper is a second revision. I'm very, very sure this paper definitely will be published by the time I'll be talking to you face-to-face. Because of the time, I would not be going into the details like why certain findings work and why certain didn't. You can ask me some questions and I would be definitely able to help that. But I think what I would like to discuss here is my experience, which I've learned as a PI leading this particular project, and also learning from a particular project which is definitely was out of my comfort level, not being IT savvy and dreaming something this big, and then having a team which is multidisciplinary, and then coming up with something at this level. I think this is something more important for me to share with you all, more than just the result findings, which definitely you will be able to know from the papers which will be published in due time. And first and foremost, what I've learned is managing expectations. What we have learned from this experience is because of the time constraint, I couldn't give you more details on the like codes from the students and all that. We realized in many of the codes, especially for the qualitative codes, students were somehow comparing virtual patients with the standardized patients, and they somehow, I felt, had this feeling that virtual patients are going to replace standardized patients. So I thought this was something very important to manage. The expectations of the team members and the students, that we were not there to replace. Virtual patients are not there to replace standardized patients. And this has also been shown in the research that certain skills like communication, empathy, and certain soft skills that we can do better by learning face-to-face. And that's the reason we are giving that baseline information in year 1 by giving that core module, right? So this module or this virtual patient training, they are being developed with the mindset, or rather with the aim of giving this reinforcement to that year 1 training in year 2 and year 3, so that students can have this reinforcement at the comfort of their home, especially to those students, because in year 1, though, yes, we are giving them exposure to standardized patients, but because of logistic concerns, we can't give standardized patient exposure to each student one-to-one. They're learning exposure to standardized patients in a group. And also some students are introverts. They are not very open to just speaking in front of their friends in role plays and all that, which we have often hear from them in their year-end student feedback. So considering those students in mind, such virtual patients can give them that comfort that they are learning something. They can make mistakes in a safe environment. They can say something in an environment, and then they can receive feedback in a safe environment, and they can make mistakes in a safe environment. So that was something I thought was very important. I learned that managing expectations are very important, and bringing everyone on the same page with open communication is very important. Like personally for myself, when I wrote this proposal and we got the funds, I was under the impression, like my clinical research I do, that when I develop interventions, for example, my research program is on women and child health. I normally develop programs for parents. So for me, when I develop an intervention or an educational program for parents, they are like good to go. And parents are finding benefits, they can just use those programs. So I thought these virtual patients will be like one of those programs. I have developed something and the students should be able to just use them and benefit from them. But even when the virtual patients were ready, I realized that they were only at the stage of UAT, which is user acceptability test. They have to go through many trainings. In fact, even now when we have so-called completed the project, they are still at the stage of, and they will forever be at the stage of constant enhancement because they are machines. Like I said, communication is something we have many permutations. So we need to constantly train them. Of course, they will get smarter with time, but the constant upgrading and training is needed. So those open communications and everybody being on the same page is very important so that we have a clear roadmap ahead that where we are going together as a team. So that is something I learned. So that will cause, I think, less frustrations. Everybody would be on the same team, and we will be able to move ahead together. Because in the beginning as a team, what we were realizing was that we were moving one step forward and few steps backward because of not everybody being on the same page, or the expectations were not managed and all that stuff. So that was something I would like to share with you what I have learned. And another crucial lesson I have learned from this project is engaging and involving students in educational projects, especially if we are developing something for students, for their benefits and their use. I feel it is very important that we engage them at the development stage. Why? Because even though I've been teaching this communication module for some time, and I have so-called done preliminary research by engaging or done qualitative and quantitative interviews with students, but I feel still having a student members in the team when you're at the development stage, you will get brilliant ideas from them. You will hear some information from them, or so-called the background information, which you will never get from those forms and all that. So that was very, very helpful, and I'm very thankful to the students who were very forthcoming. And I know it's on records, but just to share with you, some grantors, they don't allow for certain educational projects to give any token of appreciation. And this project had no token of appreciation for any of the students who were engaged as the so-called the research team, or even those who were the participants. But I was overwhelmed with the response and the so-called the positive response we have received from our students, that they were so forthcoming that they saw the meaning behind this project. I remember Dr. Dujipa will always share that if students see or the staff see meaning behind things, they will come forward. So this was one project which we received overwhelming response from our students, positive response from our students who were going out of their way to help us test and develop this module and this project. And lastly, my personal experience in 3 Ps, which is plan, plan, plan. You will plan, and then you will hit a roadblock, and then you replan, and then you plan, and that will lead to your perseverance. You have to persevere. There will be definitely some sleepless nights, or sometimes you feel that you have budgeted everything, but some certain things are coming up, and then certain things like I share with you my experience. Like it was a UAT, which was not my plan. I thought it was just ready like that, and then the second thing happened. We thought we will be able to develop and get this virtual patients tested anywhere, but when it was time to test, we realized that we needed a control environment. And then, so we had to have the initial testing done in the control computer labs in NUS. So all that, it's not just easy, just book the lab, because you are dealing with students. They have concurrent, the semester is going on, they have classes going on, so many other things going on, and booking the labs during the peak hours, and no, things are different now. I think all labs and the rooms are available now, but it was not easy. It was quite an uphill task to get things done. In summary, we receive a mixed views about this project, that the virtual patient interactions with the patients, the students found it beneficial, and they felt that the potential effectiveness of using the virtual patients in teaching effective communication to nursing students. At the same time, students also felt that, especially from the qualitative interviews, and that's another thing I would like to share with my colleagues in NUS, that I know we nurses like to use qualitative research quite a fair bit, but if you can, try to have some interviews with the students, because they can give you more than surveys, a lot more information. And I'm very, very thankful to all my participants, student participants, and the clinical facilitators, because they have given us detailed recommendations that how we can actually enhance our virtual patients further. So with that, this is our road ahead now. We will be continuing enhancing our virtual patients based on the beautiful feedback we have received from our students as well as the clinical facilitators. And I'm working with NUSIT now to make these virtual patients available for our upcoming batch of students, especially the year 2 and year 3, for them to practice these scenarios. And they will be hosted at Luminous in the upcoming semester. And we also we are in the negotiations with our local institutions to make these virtual patients deployable at their institutions. And most importantly, I'm looking forward to test these virtual patients actually off campus, so that we can see the stability of these virtual patients to actually, especially in this time, in this new norm time, I think this is the need of the day, the need of the time, so that we can actually make use of this beautiful technology and also benefit our future students. And last but not the least, but definitely my colleagues from IT department feels very strongly that definitely will make and save a lot of money in the long run by introducing virtual patients. But I think we still need objective data. So we would like to collect some information to actually share with our colleagues and management the cost effectiveness of using virtual patients in future. So these are some of our future work in the pipeline in the next 1 or 2 years to come. And I hope I'll be coming back again to share with you my experiences. Before we end the presentation, I have this short, around 4 minutes plus video for you all to watch, which will summarize whatever I have presented, and also will give you a short demo on what these virtual patients actually look like. Thanks. Effective communication is an integral part of nursing profession. Here at Alice Lee Center for Nursing Studies at NUS, nursing undergraduates are taught communication skills as a core module.
I understand that you feel like it can be a little bleak right now, but I would like to recommend your effort for keep trying and moving forward, even though it's very difficult for you. Yes, and thank you for telling me all this. I know it must be very hard for you to open up as well. So can I ask you more about your family and your lifestyle?
In order to enhance and reinforce students' learning experience, we have used artificial intelligence to develop virtual patients. These virtual patients are developed based on authentic case scenarios, and these virtual patients provide unlimited interactions to these nursing students to practice their communication skills anywhere, anytime.
Okay, Wes, you mentioned about feeling low. Could you tell me more about this?
Don't know how to explain. Just that I am having a low mood. Don't feel like doing the normal chores like bathing and going out.
Did anything happen 2 weeks ago?
I got fired from my old job. Even though I have gotten a new job, I can't cope.
We'll try our best to get you through this.
I hope so. I hate this feeling.
I just did his parameters and I think his blood pressure is coming down.
Okay, what is his blood pressure reading?
Patient is hypotensive, blood pressure 87/60.
Okay.
I'm worried about the patient's current condition.
Don't panic, we can work through this.
I think the patient is going into hypovolemic shock.
Okay, what are your recommendations?
I suggest we give him IV fluids.
Okay, thank you. Please administer IV normal saline 0.9% 1 pint over 2 hours. I will review patient as soon as possible.
Can I confirm is IV normal saline 0.9% over 2 hours?
Yes, IV normal saline 0.9% 1 pint over 2 hours.
Please come and review the patient as soon as possible.
Okay, thank you. I will review patient as soon as possible.
Our ultimate aim is to enhance students' learning experience and at the same time for nursing undergraduates to become effective communicators when they deal with real-life patients, colleagues and healthcare professionals during their clinical posting.
So initially it was very awkward speaking with the virtual patient because we're so used to communicating with the standardized patients that we get during our sessions, but eventually we got more used to the patient, and the fact that the VR patients' responses were different than our normal patients and they were definitely more varied. So in that sense we got a chance to learn to work our way around what they say.
Now the use of AI, I feel, can be used to supplement the current communication modules. Most importantly, I feel, is the fact that it gives the students a safe, non-judgmental environment for them to be able to practice their learned concepts and maybe relearn their forgotten concepts anytime and anywhere they want, as long as they have the AI on their computer.